Live from the beautiful twin island of Trinidad and Tobago, here is Nurse Jones.
Our first question to you, Mr. Dano, in a very simplified way, what is diabetes in a nutshell?
Okay. Well, before I give you my definition of diabetes, let me tell you what's thought to be diabetes by most people, which is simply diabetes is sugar. So they always say diabetes is sugar or having high sugar.
Yes.
Which isn't the case, or rather it's just half of the case. It's just half the story. What diabetes essentially is, it's the inability of the body to deal with sugar, which simply means that your body is a beautiful organ, a beautiful system designed by the Lord, and it's designed to deal with sugar. It's designed to deal with anything you put into it, right? So when you eat a big slab of cake, your body is designed to deal with that and appropriately metabolize it. What happens with diabetes is that you have, over time, let me say you have wearing out of the organs that deal with this. In particular, the organs are the pancreas and the liver. So people tend to associate the pancreas, but it's really the pancreas and the liver having major influences in diabetes. So the major cause of diabetes, we have all been told, was excess sugar. So when you're young, your mother would tell you, if you eat too much sugar, you'll get diabetes.
Yeah.
Right. That isn't the case. That is a myth. It might be true to some extent, but what really happens is that diabetes is caused by excess fat. And that's the main cause of diabetes. So what happens is that when you take sugar into your body, you need to get the sugar from the blood into the cells, into the muscle, where it's supposed to be used, because you use sugar for energy. So you need to get into the muscle. To get into the muscle, it needs to pass through a doorway. But that doorway isn't open all the time. The doorway has to have a key to open the doorway, right? So this key, as you may all know, might be, the word insulin. So you all have heard insulin. So insulin is essentially the key that opens the doorway. So when you put sugar into your body, the pancreas detects that there's sugar and makes keys. So the keys goes into the bloodstream together with the sugar and opens the doorways to the cells, and sugar gets into the cells and it can do its job. It could give you energy.
Right.
With diabetes, however, and the cause of diabetes is the excess fat. So what this excess fat does is it blocks up the keyholes, essentially, the keyholes to the doorways. If these keyholes are blocked up, keys will be made, which is insulin. Insulin is made, and the keys don't work. Because if the keyhole is blocked, the key is not going to fit, right? And if the key is not going to fit, then the body is going to say, okay, sugar is there in the body. Sugar isn't getting into the cells. We are making insulin. Insulin isn't working, so let's make more. So the body makes more. The pancreas makes more insulin. When the pancreas makes more insulin, now you get more keys. So some of the keys will work, some of the keys wouldn't work. But sugar would get in. So this is at the point where we say the patient is pre-diabetic or has pre-diabetes. Because we have the exhibiting sign of hyperinsulinemia, or essentially you have excess insulin in the blood, because the pancreas is making extra insulin. And what happens to every machine that overworks itself? It shuts down over time.
Yes, after a period of time.
Right. So that's essentially what happens to the pancreas. It essentially shuts down over a period of time because it's making the insulin, it's making extra insulin to cope with the glucose load because of insulin resistance, because of impaired glucose tolerance. And this is the two terms that are thrown around to all talk about pre-diabetes, which simply means that the sugar isn't getting in. And at this point is where we could intervene. Here is where interventions are most important, because it's at this point where interventions mean the most.
Yeah.
So if we, first of all, reduce your weight, and that's the first major step you could take towards regression, right, away from the disease, If you lose weight, then that's the first thing you're going to be able to do to help you to decrease the insulin levels, to increase the sensitivity of the cells to insulin. And then diabetes essentially is going to be blocked from really progressing, right? So this is where we talk about having diet change. This is where we talk about having appropriate exercise. And it's here where these are the people that if you go to a health center and have their blood sugars tested, it will be normal because the body is overworking itself to make itself normal. So conventional tests wouldn't give you a result.
Right.
But this is where people exhibit other signs, and this is where some of my work in UE is, looking at some of the signs where a person with prediabetes could detect and say, okay, something is going wrong here. I need to make a change, otherwise I'll become diabetic.
Right.
One of the signs, and we see this in children, is hyperpigmentation, which acanthosis nigricans, if you ever heard of it, is the hyperpigmentation or darkening of the skin.
Okay.
So this happens in particularly behind the neck, on the folds of the skin, and it's misinterpreted for dirt. And a lot of times, a lot of children, overweight children would have it, and adults would have it as well. And parents tend to think it's because of hygiene, but it's not, right?
Right, so those are the early signs.
And this is something you need to look out for. If you have a child with this, especially if the child is overweight, you need to see a doctor immediately, right?
That takes care of what is diabetes in a nutshell. And it brings us, as you spoke of some of that first sign, to the other symptoms of diabetes, things that you should look for.
The signs of hyperglycemia, when your blood sugar is high, you tend to feel irritable, you tend to be clammy and sweaty. Another one is being frequently thirsty, being frequently, using the bathroom, urinating frequently, and those are also signs and symptoms that you can look out for.
So in taking care of the symptoms, we would like to know what are some risk factors for diabetes.
So before I answer that, let me just clear up something. We've been talking about diabetes,
yes,
but we know that there are two major types of diabetes. So there's type 1 diabetes, which is quite rare, meaning it only accounts for about 5 to 10% of our population. And then there's type 2 diabetes, which is the diabetes that we generally refer to when we talk about diabetes. So for type 1 diabetes, we typically tend to see this being exhibited in children. First of all, in children. We start off in children, very, very young children. Through no fault of their own, their pancreas shuts down because their body attacks the pancreas, destroys it. So these are little children, 5, 6 years old. They tend to be very, very small, very, very frail, and their bodies cannot produce insulin. So we need to inject insulin from exogenous sources, inject it into them for them to survive. And that's a type 1 diabetic person. And the only risk factor they might have is genetic, or probably some sort of other mutation, and that's type 1. So I just want to get that out of the way first. Type 2 diabetes, however, this is the type of diabetes you would get because of lifestyle, mainly because of lifestyle. And a lot of times people would tend to think that type 1 diabetes is when you're on insulin, and type 2 diabetes is when you are on tablets. And that's a misconception that we have. Type 1 and type 2 diabetes is just simply the cause. Its difference is in its cause, right? So the cause of type 1 is an autoimmune disease, which isn't caused by lifestyle, and type 2 is mainly due to lifestyle. So type 2 diabetes is what I just described of how fat blocks up the keyholes and insulin cannot go in. Right. So again, the main risk factor that you would have is being overweight, right? And being overweight, you are overweight because either or both of these reasons, which are poor diet and lack of exercise, right? So those are the two main reasons that you would be overweight: poor diet or lack of exercise. And there is also a minor predisposition in terms of your genetics, meaning that if it's in your family, in particular people of color, which influences everyone in Trinidad and everyone in the Caribbean, basically, almost.
At one point in time, the theme for diabetes in prevention programs has been a threat to our future. And we just want to explore that a little bit.
Diabetes doesn't only affect the patient, but it also affects the entire family.
Right.
Not only because directly the family would have to change their lifestyle as well, which is a good thing, because usually all of the family members should eat from one pot. If you're cooking food, right, they shouldn't just cook for a person with diabetes.
Right.
Cook for the entire family, just as though they're living with diabetes. Because if you eat and you live like if you have diabetes, then you wouldn't develop it, essentially. And that's really how we're supposed to be eating and living.
Yeah.
Right? But not only that, is that it also affects productivity. So if you have the breadwinner of the family, the man or the woman, the mother or the father, being a person with diabetes, then if they develop symptoms, if they develop eye problems, retinopathy, if they develop further chronic problems, kidney problems, problems with the extremities, if they develop problems where they require amputations, that would hinder the entire family's ability to provide for itself, and the productivity of the entire family and the productivity of many families are affected by that. And that's why it's directly a threat to our future. But what I interpret that slogan to mean more is that diabetes really needs to, we really need to look at the disease differently, and we have been looking at the disease differently. Typically, we always say diabetes is a old people disease, and that's what the misconception is. The thing is, it starts as a child. Diabetes starts as a child. If we say it's a threat to our future, the future of the human race is our children. So if we don't look at our children now, and we see what's going on now, then the problem that's coming in the near future is very, very insurmountable if we don't do something about it now. So the problem really lies with our future. Let me just give you a little bit of statistics that we've had for the past couple of years.
Yes, we'd appreciate that.
So we did a project, Johns Hopkins University, in collaboration with Trinidad and Tobago Health Sciences Initiative, worked with the Trinidad and Tobago Olympic Committee in a project that they did in South Trinidad, and this was in the Point Fortin area, where they assessed primary school children, right? In their assessment, and this assessment was done about 2 or 3 years ago, so this data is a little bit it's a little bit old, but it represents what's happening in Trinidad right now, and it's actually, I can assure you that it is worse than what it was then. So what we found was that 1/2 of all children in primary schools are overweight. 1/3 of all children in primary schools are obese, right? That's the statistics that we've found. Through every age group, from first year right up to standard 5, children in Trinidad and Tobago are fatter than children in the United States. And we've compared that and showed those statistics. And that was a few years ago. So this is where our future is jeopardized. This is where we really need to look at. And this is where interventions need to start. We need to teach children how to eat properly, how to make proper decisions, and not bombard them with all of the fast food ideas, all of the sweet drinks that we have in the cafeteria. Those things should not be sold in a school.
Right.
Those things should not be available to children. They should not be pushed on the children. Even the school lunch program, that needs to be revamped, and the meal options, as I have seen so far, are not as healthy as they should be. Yes, they need to be appealing to the palate of a child, but we need to change that over a period of time. We need to show to children that yes, food could be tasty while not being full of fat, while not being full of salt, and while not being full of sugar.
And we can definitely speak to the children about this, because apart from putting the healthy foods in front of them, you can have that discussion, because it's amazing the level of conversation that a 6-year-old can now have with you. So, you sit down, you discuss with them, okay, the reason why you're having this, and you explain the benefits to them. It's very important that a person, whether they are diabetic or not, have goals in life, because goals tend to steer us in the direction we would go. We would put plans in place to achieve these goals. But specifically to a diabetic person, what are some of the goals that they should have in their life?
The main goal should be maintenance of your weight, maintenance of a healthy weight. A healthy weight is a weight that doesn't hinder you from performing all of your activities. You have to have a lifestyle change, which simply means that you need to gradually cut out, gradually reduce to a point which can be maintained. And that maintenance point is where you would have to continue on for a long period of time in order to maintain that weight.
Okay, so that's one of the goals that diabetic patients should have in terms of their weight.
Right, that's the main goal. The next thing a person who is living with diabetes should have is that they need to be able to meet their targeted biomarker goals, meaning that you need to have a blood sugar tested and on par with what's recommended by the doctor. First of all, you need to have HbA1c tests done.
In terms of maintaining your blood sugar, in terms of the healthy eating habits, so that is like a broad heading for goal placement. We can also include the dietitian there, right? So we more or less would take a multidisciplinary approach to achieving these goals. What support systems are there for the diabetic patient? Because anyone who has to deal with any problem or challenge, it is important for them to know that, okay, this is available for you. We can work together. So who are the key persons, or what are the resources available to them?
Okay, first of all, in the public sector, people living with diabetes always have access to primary care, which is the health centers. So there are a lot of health centers throughout the country, and they are accessible to almost everyone. Wherever you live, there's always a health center nearby.
Yeah.
At each health center, there would be a diabetes clinic. At the diabetes clinic, they offer counseling, testing, treatment, and medication is available for free.
Diabetes Association. So just tell me, how long has it been around?
Right. So the association has been around for the better part of about 25 years. And again, we have about 24 to 25 active branches.
Okay.
The main branch, the head office is in Chaguanas, and you could reach us via our Facebook page if you want, Diabetes Association of Trinidad and Tobago, and you could get all of the information for all of the branches there and contact information as well.
Okay.
Besides having general meetings throughout Trinidad and Tobago, we have large events that we put out throughout the year. The biggest event that we're planning to have this year is the Diabetes Symposium.
Okay,
Right.
tell us a little bit about
So
that.
this is scheduled for the 11th of June. So we have that on the 11th of June. Proposed location is probably in UE, so we're trying to get that location. Essentially, this is a day of education. So all of the public is invited. People living with diabetes, people affected with diabetes, people want to know about diabetes, everyone is invited. Lay persons, professionals, nurses, doctors, everyone is invited.
How can I become a member of the Diabetes Association?
So becoming a member is very easy. First of all, we always advise that you contact a branch first, the branch closest to you.
We can find this on the Facebook
page, you find you'll find the branches and you'll find contact information for them.
Right, so we're coming to a close here, but in so doing, I just want to put a little scenario out there and just tell me basically how you would approach it.
Mm-hmm.
So you're in a clinic setting, you work in the clinic. The patients who attend, they come on a regular basis, so you're familiar with them. However, a vendor comes in one day and he is selling caramel. And we all love a good caramel, that sweet, that is just delicious. So he comes in, caramel, 4 for $10. and you see a patient who is a known diabetic, and they are like, oh, I'd like to get some caramel here, and they buy. So how would you approach that situation when you know, like, this could be a terrible situation for them?
The first objective is not to shame the patient, because you're going to discourage them. You're going to discourage them from taking care of themselves. Yeah, you might stop them from eating that caramel, but in the long run, you're going to discourage them from taking your advice as well, because they're going to see you as somewhat of a threat. But in essence, what you really need to break it down to is you need to put it into their mind, or you need to make sure that they know that living with diabetes doesn't mean that you cannot eat any sweets. You can't have the caramel. That doesn't mean that. No. You can have caramel, yes. You can have anything you want to eat. But the thing is, you can't have all four at one time.
Right.
You shouldn't even have one whole one at one time. You can't have one whole one at one time if your blood sugar is very low, if you haven't had anything very sweet or high in carbohydrates for the previous few days, right? Yes, you could probably have one, right? But you need to just limit how much you have. So that is all you really need to break it down to. You need to say, yeah, you know you have that, but make sure you know you only have one, and make sure it doesn't raise your blood sugar too high. But that's okay. You can have it, right? Put it away for later. Share it with a friend. But always watch how much. So it's moderation and how much of something that you eat.
And I think that's an important word in the diabetic's life, moderation, because it would apply to exercise. You know, it would, across the board, it would apply. All right. So I love how you dispel that situation there. In closing, would you like to cap on anything in particular?
Well, to end off, I'd just like to reiterate the 4 pillars of that each person living with diabetes should maintain in their life. The 4 things that they should always keep close to them and maintain. The first of which is exercise. So exercise, you need to be able to maintain or exercise at least 3 to 4 times a week. The second thing is your diet. You need to be able to have a healthy diet. The third is your testing, right? So you need to be able to test. You need to test your blood sugars all the time. You need to be able to stick within your biometric parameters. You don't want to have your blood sugar go up too high or too low. So you need to maintain it, and particularly HbA1c test, which you should have every 3 months, and you should aim for under 6.5.
Okay.
Right? And the 4th pillar, which I think is very important for most people living with diabetes or any disease, is their mind. You need to have a sound mind, and you need to be able to keep close to whatever your beliefs are.
Thank you, Mr. Dano, for sharing that vast amount of information with us. And the highlights for this podcast will be posted on my website, www.nursejones.me.
Thank you.
This segment has been brought to you by Amazel Enterprise.